Good morning, everyone. This is What's Your IQ? Let's talk about your impact quotient with Nancy Barbie. And my guest today is a woman that I met just recently in Pakistan. Melissa Cockum is the chief of the polio team in Pakistan. And she's been with UNICEF quite a number of years and it has a lot of experience with the polio eradication. And I think most recently, you can correct me if I'm wrong, she held the position of senior manager for the polio outbreak response in UNICEF, co-leading the Global Polio Eradication Initiative's outbreak response and preparedness group. And you also helped close polio outbreaks in over 40 countries in Africa and Asia. So, wow, what a great career and what a great purpose you have in life. So, thank you again, Melissa, for being with me today.
It's a great pleasure to join you. Thanks so much for the invite.
Yes, well, and I just asked you a question right before we came online, and I'm going to
Mhm.
ask it again. Someone was telling me or asked me, who does the training of the polio workers in Pakistan and other places? Is it WHO or is it UNICEF?
So in most countries, Nancy, WHO takes the lead in the training of the frontline workers as the lead for operations. But UNICEF, because of course, as we all know, the interaction of the frontline worker at the doorstep and the interpersonal communication is so important. So UNICEF supports WHO in making sure the frontline workers, the vaccinators, are equipped with good interpersonal communication skills. At the same time, in Pakistan, because the program is so large, UNICEF also has a network of community mobilizers and communications folks. So we obviously train those community frontline staff to do the engagement so that they're equipped to do community engagement in support of the frontline workers.
Mm-hmm. And there's still a lot of misinformation that remains one of the biggest obstacles in ending polio everywhere, not just in endemic countries, but in the United States as well. A
Exactly.
lot of misinformation going on. What have you learned about why families refuse the vaccine and what really changes their mind?
Well, the acceptance is a complicated phenomena, and it's not something that's fluid, static. It's fluid. So, and because in places like Pakistan, the number of campaigns that we're doing is pretty high. So, from one campaign, a parent's decision could change, so it doesn't remain static. And there's many different reasons why parents refuse. It could be that they're just tired, they've had enough, too many rounds. It could be that they have demands for other services in many communities. The communities want other services expect other services from their government, like schools and roads and other things. And it's a way of having agency and speaking up to the government that it's not so much about polio vaccine, but it gives them a platform for voicing their other demands to the government. Misinformation and rumors is one issue. Religious beliefs. And so it's there's not a one overall reason why parents refuse, and which is why it's important to understand the reasons for refusals so that we can identify possible voices and stakeholders as the front, in terms of engagement. If it's for health issues, or they're concerned about their child's health, or their child is sick, a doctor is the best
Mm,
point of interaction. If it's related to religious issues, then it's a religious influencer. So
mm.
really deep diving and understand the why, and it helps us to identify who should be the one that is interacting more effectively.
Great point. That's exactly right. The first day that Mary Shackleton and I were visited Pakistan, the very first day we were taken to a school for the disabled or d differently abled children that were blind and has hearing problems as well. And it was a measles um,
Mhm.
vaccination immunization. And it was a big deal. I mean, there was UNICEF was there, you were there, WHO was there. Why was that so important? I mean, it was measles, but it was also polio. But why was that so important to do it at that particular place?
Well, for measles campaigns, it's not a campaign where we typically go house to house. And so to get as close as possible to communities, because of course, when you're vaccinating, I mean, the numbers of children over the course of a week or so, just relying on health facilities is not going to help us reach our target. So we go the micro plans identify areas where children are. So because of the age group, children are in school or children are in their community. They could be at daycare. So, it's trying to get as close to children as, groupings of children so that we can reach as the high numbers of children. Because for measles, we weren't going house to house,
Hmm.
which is why schools become an important, in many countries, not just in Pakistan. Um, and of course, in addition to polio, measles is a big killer of the number of cases and the numbers of children affected by measles in a country like Pakistan is pretty high. And typically, communities demand measles vaccine because parents know that measles is a tragic disease, and whereas polio has become because you don't see it. The numbers are so low now, and the way polio is presenting because of better vaccination, it isn't. Many people don't feel it is as important as a disease such as measles because it kills children, and so schools become an important site for vaccination when we're doing these types of campaigns.
Well, it was a great turnout, and parents were there, and
Yeah.
the children were excited, and everyone was excited. And I was happy to see the polio vaccine delivered at the same time. So
Yep.
that made it very meaningful for us,
Yep.
and especially in Rotarians. Of course, we're behind all vaccinations too, so that's
Absolutely.
great.
Well, and we shouldn't miss any opportunity. So this
Mhm.
was a measles campaign, but because the target group is the same, we try to integrate activities so that it takes less resources, obviously, because you're not doing two campaigns. It also means one campaign less. So for parents, you have one campaign and two antigens, polio vaccine as well as measles. So it's a win for communities, parents, donors, but also for the program and health workers themselves.
Yeah. Well, there's a lot of still um, uh, people in the field that are at risk for violence and for to being attacked and even killed. Does UNICEF do anything to support those people, or how does UNICEF fit into that capacity?
So within the Pakistan polio program, we actually have a fund which is available. And so when we have not just frontline workers that I mean, in principle, the frontline workers themselves aren't the target any longer. Now that can change, but for the most part, it's not the frontline workers who typically over the past several years, those that have tragically lost their lives have actually been the security personnel that provide protection rather than the health workers themselves. But in the Pakistan program, we have a fund that any frontline worker who loses their lives, and it doesn't need to be just because of a armed, an
Violence.
attack,
Yeah.
shot or violence. We also lose people due to road traffic accidents, for as one example. We had a frontline worker in Karachi, for example, who somehow got her piece of her, I think it was her headscarf caught in a rail track. She lost both of her legs.
Oh.
Um, by she got run over, I believe, with it by a train. So she is supported. She's still alive. But that also means some rehabilitation. So
Mm.
the program has a fund that is available to provide support to those who have been injured, but also to the families for those that have lost their lives.
Wow. That's great to hear. That is great to hear. And hopefully, do you travel all over Pakistan? Are you in all the places that are not
It's been
so
good.
safe too.
Unfortunately, I'm not always able to go where I'd love to be able to go. I travel a lot in the country as much as I can, and I've been in the past year to Khyber Pakhtunkhwa and to Baluchistan and Sindh. I've traveled all of the provinces, but I'm not always able just because of our security rules to travel to some of the hotspots.
Mm,
But I do try to travel as much as I can, not only because of, supervision, but it's also important to motivate the frontline workers. I think that is as important as anything else, as opposed to just finding the issues and resolving them is important. But I think even more importantly is the motivation of the frontline workers.
mm. Well said, exactly right.
Yeah.
So, in India, the government sets the national immunization days. Is that also true in Pakistan or
So we work as
WHO?
a, yeah, absolutely. We work, of course we um look at the epidemiology, when is the virus transmission times you have high intensity times and lower intensity times, and that is important. We also look at school calendars. We look at important, Eid during Ramadan, for example, we can't have polio campaigns. It's just not feasible. So there's a lot of factors that go into planning our calendar. And the other one as well for Pakistan is we try as much as we can to align our calendar with the Afghanistan program so that trying to get the dates as close as possible because of the population mobility with Afghanistan as the only other endemic country in the world.
Right. Do you travel to Afghanistan or do you tiptoe across the border?
It was enough. I travel, I was there twice past year. I was most recently in Afghanistan in November. We, as UNICEF, try to meet our country leadership teams. So I travel with my country rep to really look at how, learnings, how do we, coordinate together. But also I was there for the technical advisory group earlier in the year.
Okay.
Yeah. So, but I also I led the Afghanistan program a few years ago. So, I was also part of that program once upon a
Wow.
time ago.
How about that? And I'm assuming that you were in Nigeria during the time of polio and eradication time there. Tell me a little bit about how that happened in Nigeria and Africa, the African region. Tell me a little bit about that.
So I was in Nigeria. I've been in Nigeria twice, 5 years as WHO and UNICEF, and I was there when the first time, obviously Nigeria had a resurgence. So, but I was there when they were taken off the list of endemic countries back in, oh goodness, 20 time is
Yeah,
blurring. It's been the
2019.
first time. So I think that, the critical factors was incredible government leadership. Government was even putting their own resources into the program.
Hmm.
The other thing was extremely strong coordination. So all of the partners were working from the emergency operations centers, and together, deep diving on the issues and looking at are we ready to implement a campaign or not? And really solid microplanning. And adaptations to the specific challenges like in northern Nigeria, northeastern Nigeria, obviously we had complex security challenges and coming up with if we're not able to reach with a typical host to host campaigns, what other things can we do to deliver vaccines in hard to reach areas? So I think in any place I've worked, government leadership is fundamental to achieving the end result.
Yeah, exactly. Well, is we're down to the last mile now. The last stronghold. We're there, and as you well know, I'm sure the last mile is probably the most difficult because the resurgence can come back quickly, and
Yeah.
you're not sure what to do. But what do you see as your biggest obstacle there, this last mile? And what can we do to overcome that?
Obviously, I mean, one big challenge in Pakistan is insecurity, and the majority, half the cases of 2025, the pandemic of last year, were from cha areas where we have issues with access. We weren't able to do house-to-house campaigns. It's a very small geography, but it's still an important one. I think, getting back to the program basics, we don't need the Mercedes. We need the Toyota Corolla, the real basic proper microplan, good team selection, proper training, good supported by good social mobilization, supportive supervision, not just collecting data during the campaign, but
Right.
really supporting those frontline workers and motivating them. And I think, as you get closer, as you get, to the end, it's very difficult to keep up the momentum all at once. So you can be doing really well in one part of the country and you feel, oh, we finished, so we can let up and focus on other things. But it's the whole country that needs to do it together. And, just because one geography may be doing better and another, that, we can't, we need to sustain that momentum and that motivation, which is
Mm.
difficult. Doing, five, six, seven, five, we did 5 NIDs last year in Pakistan. And plus other campaigns, including the measles campaign. Maintaining that motivation is incredibly challenging. That's why I mean, I have to appreciate you and Rotary, because I think, you are the heart and soul of it. You remind us of why this is so important. We get caught up in the numbers and the figures, but that heart of why we're doing this becomes important as a reminder and that also helps motivate. Certainly folks like us at the, national provincial level, but also even at the frontline level, because it is incredibly challenging, and there's lots of pressure.
Yeah, absolutely. And that's good to hear. That's good for Rotarians to know too that, our job is advocacy, awareness, education. But it is important for us to support the partners that are in the field.
Yeah.
And that's UNICEF, that's WHO. You are in the field every day, all day. And I was just amazed. At the dedication of the Rotarians, along with the UNICEF workers and WHO workers, everyone that was just very, very dedicated. Of course, when we were there, to be honest, Melissa, we were in a bubble, and we
Yeah.
were, we were in the places that were safe. No problem. I don't have any problem with that. But but we were made aware that, there are areas that are dangerous, and there are areas that are harder to reach, and people that are harder to reach. Um, can we ever do that? I mean, will it ever happen, do you think?
Eradication?
Uh-huh.
I have to, I mean, I've worked in the program now for 25 years-ish, give or take. And
Well,
so, and I have to believe in my heart, that's what keeps me going, is that it can be done. And it has been done in some of the most challenging countries, including Nigeria and Congo and war-torn countries like Sudan and India with high dense population. So I have to believe, and I feel that the building blocks are, there is some positive things coming into place with some, we in Karachi, you were there, I remember, just after this audit where, we had this experts come in, and I think, like I say, the most important thing they said is you've got to get back to the basics. You don't need fancy things. You just need you focus on those. And if you focus on those, then I believe it can be achieved. And then of course in these places where we do have challenges with security, it's just having some other adaptive types of activities. I mean, the unique thing about where we have issues with access, it's not like a place like Karachi where the density of population is so
right.
high. It's very, very, more sparsely populated, which is a positive thing. So, having other things like integrated services, so, nutrition and other things that can help pull people to a facility with services that they are interested in, can help provide an additional, immunity boosting activities for children in those areas. But
Mhm.
I have to believe in my heart and all my being that polio can be eradicated.
And I'm right there with you. I also believe it because I've seen places. I went to India. I was going to India before it was completely eradicated, before it was declared polio free. And the same things that I saw in Pakistan are the same things that I saw there. I did see the campaigns going out in the field, working in the areas where it is densely populated, going to the train stations, going to the markets, places like that where the children are, and
Mhm.
walking along the street. We were in the train station, and a father passed by, and the healthcare worker said, "Has your child been vaccinated?" He said, "Not recently." So we immediately gave him the vaccine. It's very encouraging because I when I was talking to a WHO worker there, he is from that area, but he works with WHO and he speaks the language, and he was very adamant about local people also taking the responsibility. You know, we can come in, but the local people taking responsibility, which I thought was just I don't know why I didn't think about that, but he made it very real. And so that was, great to see.
It has to be local. I mean, in areas where, we talk about, hesitancy and acceptance, but, that because it is something that is being delivered at a doorstep, that local trust needs to be there. And then that has to be from the locals themselves, not from us, from coming from outside. And it needs to be from the local communities.
That's right.
Um, yeah.
And how do you explain, because you talked about earlier about different needs of the people, and especially when they're facing lack of food, they're facing, poverty, floods, homes being destroyed. And how do you explain the importance of the polio vaccine and so that it really resonates with them that yes, this is important. Yeah, we know you're hungry, we'll help you there too, but why is this important? How do you explain that to them?
It has, from my perspective, it has to be government leading that conversation, but it's important to de-link polio from, you know, these other demands. So, things have to be taken one by one. If you start putting all these things together, it's very difficult. We had a situation in Pakistan where the demands were peace. Well, lumping polio and vaccines with peace, I mean, you'll never get so trying to de-link polio from these other things through discussion and dialogue. Um,
Mhm.
is really important and putting children at the front of it because children tend to okay in not everywhere and you can never resolve all of these issues. I mean there and it will never be we finished it, we've resolved this issue, and then it's we're not seeing that issue again. It'll pop up in another community or in another house, on another street, just because again it doesn't remain demands don't remain static, and people become disenfranchised from their government. And because polio, finding that balance of government leadership and visibility is very challenging because by being a visible program, which the government is committed to doing, it also then opens up doors to say, okay, this is what's important for the government, then this, you know, um, but really trying to de-link that from polio and to listen to communities is very important.
Absolutely. How important is it, or how, I mean, it's important for us to go to Pakistan, but how is it reciprocate from the standpoint of the people and the workers that are there? I mean, how important is it for us to bring a group there so that they can see?
I think I think it's important that, sustaining the Rotary is one of our biggest, I mean, you had the vision, Rotary had the vision of eradication. And so sustaining the motivation of Rotary and Rotarians towards finishing it because I mean, incredible donor and partner in this program, and that motivation is critical. But I also think that having people coming in and and motivating and giving some inspiration to the frontline workers and also to listen to them is really important while respecting and not disrupting the activities on the ground, because at the end of the day that's what we all want, is to
Right.
have a good quality campaign. But I think it works both ways, the motivation on the front line and to those that, we're here together, we're here to finish it, is very important.
Well, and it's very important for us too. That's one of
Absolutely.
the main reasons I've seen now what is happening. And as again, after seeing it in India, but now I don't see quite as much of the same hands-on type things as I did prior to eradication. Seeing it again in Pakistan has really renewed my oomph. We've got to
Yeah,
get this done because, sitting in the emergency operation team, sitting in that meeting and listening to the top leaders in polio eradication effort in Pakistan was powerful. But also then going into the field and seeing and I tell you, I think one of the most memorable moments for me and I think Mary as well is we cleared 3 refusals. So, they had come previously and they'd been refused, and we were able to vaccinate those children that day. I'm not sure still exactly why that happened or how that happened. All I know is we vaccinated a child. And to me, it's not a case of polio, it's a child, you know.
absolutely.
And so
Yeah.
anyway, but that was very meaningful. And so
Well, and you can then tell your stories. You've seen it. I mean, I remember when I first joined the polio program, I was with WHO in Geneva and doing media and communications. And it was actually when I saw it for myself, rather than just hearing it from my colleagues and peers, that it made a difference in being able to tell the story.
yeah,
And that is important in your, with what
yeah,
you do and explaining, because you've seen it, you've experienced it, you've felt it. And that is powerful. And it's not just a PowerPoint presentation or even a video. You have real stories that you're a part of that you can share with others, your peers, your other Rotarians, as an advocate.
yeah. And and then I get to meet people like you that are in the field all the time and carry that message daily and hourly and minute by minute. And so that makes a difference too to be able to talk with someone that's been in the field. So I mean, you're from Canada originally, is that right? How in the world did you end up in Pakistan? I
Yeah,
mean,
well, I don't know actually, because actually when I left Canada with my sister, we were planning, I left with one backpack on my bag after I graduated from university to travel. We wanted to backpack in Europe, and one year became now that was 1997. And so we started backpacking in Europe and Africa, and somehow I applied for a job in WHO for polio, which I can't even remember applying for. And I got it. And so that's a lifetime ago now. And
wow.
yes, and many countries and geographies, but it's not a job anymore. It becomes kind of part of who
Yeah.
you are. It's not, if you want a 9 to 5 job, it's not for you, because it's a very, it's all in.
That's exactly right. It is all in, and you're right. And that's why it's been so effective. That's why our partnership with Rotary, UNICEF, WHO, uh, Bill Gates Foundation, Gavi has been so beneficial and been so effective because it becomes more than just a job, it's a lifestyle.
It's a life. Yeah. It's
It's,
a commitment, it's a passion, and if you don't have it, then it's not for the lighthearted.
exactly. And one last story I'll tell you, and then ask you one last question. But when I was talking to one of the health workers, and he's the same man that's from that area, and he said, I've been told that I have a 9 to 5 job, and he said, but it's not 9 to 5. He said, I can't. He said, my boss called me one night at 10 o'clock at night and said, why are you still out in the field? And he said, there were some people that moved in, there were children that moved in here from another area, and I wanted to be sure that they had been vaccinated. So I had to catch them right then when they were moving in because I was afraid I would lose them. So that's the commitment. That is the lifestyle, that is the mindset, and that is why we've all been so effective. So thank you so much. But any last words of wisdom if I were to ask you, what do you want me to tell the Rotarians here in the United States that are not aware and not as it's not on their radar screen as highly as it is in other places? What message would you have me tell them?
I think it's don't give up. Because Rotary had the vision, Rotary had the dream, and now's not the time to give up. And I think um, we those of us that are working on the front line are committed to working to finish the job. So don't give up. And we're so close. I know we keep saying it, we are so close, but I do believe that we are very close. And so don't give up, never give up. Um, keep with the vision, keep with the spirit, and keep this heart thing. I keep, we are WHO is kind of the brain, and we get caught up in the numbers. Be true to yourselves. You are the heart, and continue to remind us of why this is so important. It's about children, and I think you know that's why we will continue to do this is for children, and I think you constantly remind us, and so remind yourselves of why, it's an important reminder to you as well of why we started this, and we will do it together because I think together we do better.
Absolutely, absolutely. Melissa, I can't thank you enough. It was so nice
Thank
meeting you in
you.
Pakistan. I hope to see you there again.
Hope
And
to see you back, and maybe in Karachi or Lahore or some other
absolutely,
place. We look forward to seeing you.
absolutely. I look forward to seeing you again as
Okay.
well. And thank you again so much for
Thank
being
you.
with
Pleasure.
What's Your IQ with Nancy Barbie. Take care.
Thank you.